Hey everyone, welcome to week 4. This week we're going to be discussing problem solving, assisting with client change, motivational interviewing as well. As a reminder, your video is due by the end of the week. If you have any questions or concerns, please feel free to let me know. So I want to start off by discussing the stages of change. Now, a lot of you probably have gone through the stages of change in previous classes, but it's really important this week because we're really always assessing at what stage the patient is in. And if we can't fully assess what stage they're in, we're not going to be equipped to be able to handle whatever concerns they bring to the table, the lack of coping skills that they have with their environment. So the different stages of change to start off, it starts with pre-contemplation. And that's when people are not seriously thinking about change. They can acknowledge the thought of change, but patients in this stage will often say, it'll be too hard to change. Oh, I can't do it. I don't have the time. They're going to constantly be making excuses as to why change should not occur for them. The next is the contemplation stage, and that is where people consider change. It seems exciting to them. However, they may start to have an adverse reaction in their life, such as psychological, physical as well, family problems they can encounter. So this is during the beginning when they're starting to think about the change and stuff is happening in their life that is making them feel like if they start to be thinking of change, it's still going to be too much for them. So next is the preparation stage, and this is where someone will still outweigh the pros and cons and thinking about the next step. They believe change is necessary and it's imminent. After that is the action stage, which is taking steps to change their behavior and making steps toward change. Ambivalence is still very strong in this stage because a lot of people will flip-flop between preparation, action. They're going to be in action, but still try to have one foot in the preparation stage because action is very scary to them. The next is maintenance, which is able to successfully avoid any temptation to return to old behavior through support, such as therapy, family support. This can also be, like I said, supported through the community as well. So there is a stage known as relapse, and I believe that it's actually the most important stage in treatment because when someone relapses, you really see their true self. You see exactly where they are and how far they're willing to push themselves through this process. In the relapse stage, you're going to have a lot of people who want to give up. They're going to say, I tried, I failed, I just cannot do it. It's not for me. I'm always going to live this life. I'm always going to feel this way. There is nothing that you can do to help me. So what I suggest during this stage is really helping them understand how much stronger they have become because of the relapse and really looking at the change that they've had from the beginning point to the relapse and discussing what the strengths and the weaknesses were, and then discussing why the weaknesses had such an effect on the relapse so that when they can begin to go through their stages again, that those weaknesses don't affect them. Now, a lot of different clients that you're going to see are going to be in different stages of change. And believe it or not, people can change different stages of change while you're seeing them. They could, be sitting in your chair for the first time and they're talking about, how they know what they need to change, how they want to change. So they're in the, preparation stage. They just need a little bit of assistance to get to the action stage. Then you're going to get people who have been through all of the stages of change and they're currently in their relapse, talking about how they don't know how to continue to move forward. You're also going to be meeting people who are in relapse and then they want to move back to action, or they're in relapse and they're back in contemplation because it was just too hard for them. So at all phases, you need to be assessing where the patient's at and how you can guide them through. Because as I stated, when patients tend to relapse, they take it very, very hard on themselves as though they will never amount to anything but still be in that feeling that they feel. You're going to see this a lot in your drug and alcohol population every time they continue to relapse on that drug. It's really difficult for them, and they start to believe that this is the only life I will ever live. So helping them and guiding them to see their own true potential is really going to help them through these stages. So understanding where the client is so that you can assist with motivational interviewing is extremely important. Making sure that the client is always the focus of change in the process. It's our job to challenge when it's needed, but always with questions that prompt the client to be empowered in the change process so that their decisions they make from their perspective are not ours, that they're their own. So using motivational interviewing, we go back to our collaborative relationship that we've developed in previous weeks at this point, and we build upon that. So change is not easy for our clients and for anyone. So when we partner with them with our relationship that we've created, it helps empower them and empowers our relationship with them to help them get through to this change. So, motivational interviewing is a method that helps people resolve their ambivalent feelings and insecurities to find internal motivation that they need to elicit the change. So I'm going to give you some examples of motivational interviewing. As you can see through your reading, there are quite a bit of different strategies and techniques. I'm going to go over a few that I think are extremely important to use in your therapeutic alliance with your patients. So the first one I want to go over is open-ended questions, and they are a large part of motivational interviewing. This allows for richer and deeper conversation with the client, and this is going to allow the client to do most of the talking, which is going to allow you to guide them and challenge them through this process and guide them to empowerment of change and empowerment of themselves. The next thing that I feel is really important and is a motivational interview technique is normalizing. I think that it's very much needed in the conversation. A lot of our clients believe that they are the only ones in the world going through this, that nobody has it worse than they do. Nobody's family is as bad as theirs. No one's circumstances are as bad as theirs. And sometimes all they need is for you to assist them in normalizing and helping them understand that they are not the only ones that are concerned with what's going on, that you can normalize that everyone is concerned about their financial needs for their family. Saying something like that to them can really assist them in understanding that it isn't just them, and their anxiety level is going to go way down. And that's where you're going to be able to use that collaborative relationship to help push them through and challenge them to that empowerment stage. Moving on to another technique that I find is really important is affirmation. It's important that the client feels as though that they've done something right, and we, as being in the collaborative relationship with them, acknowledge that positive change, and that allows the client to feel empowered to continue to change through the positive affirmation that you give them in your sessions. So please remember that often the clients that you're going to see don't get much positive affirmation from other aspects of their life. So when you're acknowledging something that they're doing, even maybe the tiny bit of change that they've created in the amount of time that they've seen you, that's a really big step for them to hear that. And that will continue to have them feel relying on you to come back and be open. So the next is summarizing, and this allows the client to hear that you understand exactly how they feel. This can also help you with transitioning to another topic or actually terminating the session at that point, because you can summarize everything that you've talked about. You acknowledge exactly how they express themselves and how they feel, and then you can move on or you terminate that session, but yet the client still understands that you know where they're coming from and you know how they feel. The last one is advice and feedback. So often with advice and feedback, you need to be a little bit careful, because in advice, sometimes people view it as you're judging them or you're telling them exactly what to do. And, in their clients, they're allowed to their own autonomy. And sometimes by giving advice, you often sometimes are offending them. So you have to be very careful in the way that you phrase advice. You need to assure that it's relevant and useful to the current stage that the client is in. Otherwise, they may take it as you being judgmental of the choices that they've made so far. So feedback is going to be used throughout your entire, through their entire stages of change. But I'm also going to let you know that it's most likely going to be used in pre-contemplation and contemplation, because people are going to be talking about their thoughts and their risky behaviors. And at that point, you're going to be providing them feedback to help challenge them, to see where exactly that they are. If they can acknowledge the risky behavior that they are in, then you're already pulling them through some of the stages of change. So giving them feedback with statistics or with relevant known facts can help guide them. So these are some important aspects to motivational interviewing that I wanted to share with you. So this week in your post, what I want you to do is choose a technique of motivational interviewing that you feel like you would use often in your practice. And what I want you to do is prepare a question for that technique, but please don't use any of the examples on the worksheet. I will check that. Please come up with your own question, your own view of what you feel would fit into that particular technique, okay? All right, so the last thing that I want to talk about is problem solving. So during the stages of change, you're going to encounter a time where a client could be stuck in a stage and a problem. So first, making sure that you fully understand the description of the problem and how the client would like to manage that problem and what in their mind is relief of that problem is really essential for you to be helping them guide through that problem. So after you've identified the problem, you're going to conduct a problem assessment. And that's going to be that the client is able to tell you the problem and helping them, which is going to be helping them go through that stage. So once you've conducted the problem assessment and you know exactly what you need to do, the next thing you're going to do is plan the intervention. So you're going to be working with the client to establish goals and tools to solve that problem. After that, the client is going to then make that intervention that you've created. Then after that, you're going to do the evaluation and the follow-up. So you're going to be talking to them about how the intervention plan worked or how it did not work. What could they have done better? How can you help them through if it did not work? Or if it did work, how they feel, giving them their own autonomy. How did it feel, to accomplish that goal? That's really a turning point for many clients. So this can be used when the client cannot get through a stage. So problem solving is key because you're going to see a lot of clients who get stuck in a certain stage. And unfortunately, sometimes it's not just the client getting stuck in the stage. It's a lot of their family and their friends really pushing against that change because for so long, all they've ever known is the person that, they were before coming to you. So when they're trying to implement change, it creates a lot of chaos in their life because family's pushing back, friends are pushing back, work could be pushing back because they don't really understand why this person is making change or how they're making change. And it is uncomfortable for them in their life because they've known that person to be one way for so long. So you are going to be encountering a lot of problem solving through the stages. So you're going to want to be making sure that you are with your client at all times, using that collaborative relationship because they're often going to feel very defeated by people not accepting their change. And you need to be able to guide them through so that they can understand how they've changed as a person and how they can show other people and guide other people to that this is who I am now. This is my positive change. So I know we went over a lot this week. Like I said, guys, if you have any questions about your video, please feel free to let me know. Like I said earlier, please make sure you're posting one technique of motivational interviewing with one question that is not in the handout. And if you should have any other questions, please feel free to let me know. Have a great week, everyone.